All right, so I saw this video of a lady and Prophet Odumeje, and the conditions she was mentioning has to do with the eyes, and I decided to post it. So let me play the video first.
Suspecting glaucoma. Okay, the first doctor said suspecting glaucoma. Yes, sir. The second one is what? Second doctor said it's papidemia. Papidemia.
Okay, so that was the video, and I got these comments. He said, ha ha ha, doc, I beg, explain these terms. Now I'm going to be explaining these terms one after the other. Remember, she said the first one is what? Glaucoma. The second one, papilledemia, and then the third one, optic neuritis. So please make sure you watch this video to the end, and don't forget to share, because I'm going to be explaining it one after the other. Okay, so this video, what I want you to do now is to follow this pointer as I explain. Now, looking at this picture, this is the picture of the back of the eyes, right? Now, these are the veins that supply blood to the eyes. Here, we call it the optic disc. It's connected to the brain. All right, here transmit images you see to the brain. So here is also the macula. This one helps you with central vision, color vision, and several other functions. All right. Okay, now, so the lady said the first disease that was mentioned there, it's what? Glaucoma. When we are talking about glaucoma, it has to do with the damage of the optic nerve as a result of sometimes increased intraocular pressure, or sometimes the pressure could be normal and yet the damage is done. There are several things that can lead to that. Now, this is, remember the back of the eye that I just showed you? Can go back to watch. So here, if you look at this now, if you check the first one I showed you, I've shown you, and this one, they are not the same. Now, this is what a glaucomatous disc looks like. The other one is very close. You don't see this white thing. You can see an arrow here indicating that this eye has glaucoma. Now, let's go to papillary edema. All right, so when we're talking about papillary edema, it's the swelling of the optic disc. Remember when I said that here is the optic disc? If you compare the first picture that I've shown you and this, you could see that there's a difference. So when here it's swollen, which is usually as a result of intracranial pressure coming from the brain. Okay, so this, remember I told you it's connected to the brain. So if there is an intracranial pressure from the brain, this place gets swollen in the eyes. This is what we call papillary edema. Now let's go to optic neuritis. All right, so when we are talking about optic neuritis, what are we talking about? It has to do with inflammation or swelling of this optic disc. Okay, remember, if you please always make sure that you go back to the first one to check if you are no longer sure. This optic disc, when there is a swelling or an inflammation on this optic disc. Now, when it has to do with papillary edema and optic neuritis, they show that they look alike. If you can go back, they look alike. But when it has to do with optic neuritis, it's usually caused by other conditions in the eye, like multiple sclerosis, or maybe as use of some certain medication. Okay, it's not like papillary edema that is coming from the pressure, increased intracranial pressure from the brain. All right, so these are the conditions. Now, for you to be able to know, you have to go for a thorough eye test. Okay, so these are all the explanation of the terms used in that video. So please don't forget to share, like, so that others can learn. You never can tell when someone can be diagnosed. So please share. Bye.